From NBC News, this is Today with Kathy Lee Gifford and Hoda Kotb, live from Studio 1A in Rockefeller Plaza.
And are your hands giving away your age?
This is weird.
This is amazing. We're going to help you wave off granny hands for good.
What?
Yes, it
injections?
involves injections. But first, your local news and weather. Look at that. All right, an injection that can get rid of granny hands?
Now there's another issue with hands. We're going to put this to the test. But first, this is Today on NBC.
Wow. You can get an eye lift, face lift, butt lift, everything. Botox to look younger. But one look at a woman's hands, and it's usually a dead giveaway.
Well, you can wave bye-bye to those wrinkly, veiny hands with a minimally invasive treatment. It's called the Granny Hand Lift, performed by Dr. Mitch Chasen, the medical director of Reflection Center for Skin and Body.
And Tara O'Leary is Dr. Chasen's patient. Mary Ellen Ferraro is the nurse. Lovely to see you all here today.
All right, so, Doctor, we do have some photos that we should say you provided us with and said they weren't photoshopped, so people can get an idea of what the before and the after look like. And this is that, huh?
Yeah, that was actually a medical assistant just a few days ago. So there's a dramatic improvement in a very rapid fashion. You know, people take real good care of their faces now, but you know, they have to realize that the hands are just about as visible as the face.
They don't put they don't put sunscreen on, and the hands are out in the sun all the time.
They're exposed to the environment.
Yeah.
They suffer from the same signs of aging that the face does.
So do you put the same stuff that you would use for Botox in the hands? Is that what you're doing?
Not necessarily Botox, but we use dermal fillers. We use lasers and topical products.
I didn't realize you also used the Fraxel that I used on my face, which
Wonderful.
is Fraxel's an awesome thing.
Wonderful.
All right, so
for
we
the
should
hands.
say that you've already shot up this hand, and it's swollen, but that's usually what happens immediately after?
Yes.
And when does that go back down?
Tomorrow, that swelling will be gone, and it'll look like we've never been there.
We need to know, because everybody's asking, does it hurt, Tara?
It did not hurt.
Didn't
It
hurt.
was just a tiny little pinprick.
Because you have lidocaine in the actual
Right, it's
filler.
mixed
Now,
in.
looking at your hands, I would look at your hands and say, I don't even know if you need it. Why do you
Yeah.
think you needed to get that done?
Well, I use my hands every day. I'm an artist, so I create things every day. And I'm also not only painting the paintings, but I'm framing them, and I'm lifting them and installing them, and putting 27 paintings in a show at the end of the week. So every time I see my hands, they're bulging with veins, because I'm working with them.
Yeah.
You know, when I'm just sitting here like this, passively, they just look fine. But when they're
It
constantly
bothers you.
underused,
It bothers you.
It bothers me.
And how long will this last? And how much does it cost? I think
It'll
people wanna
last
know.
at least a year. Subsequently, it'll last even longer. And it's about $1,000 between the fillers and the laser treatment, etc.
For both hands?
Yes.
And if you are, I mean, you're catching it obviously really early, but if you are already older in your hand, are you going to get a remarkable
get
result?
an incredible result.
Really? I'm
Yeah.
scared. I'm talking a lot, so I hope you don't stick her in front of us, but I guess you're going to do it.
Tara's smart by catching it early. She's smart.
So where do you inject it exactly?
So we're going to inject at the base of the hand, and then we're just going to gently massage. And it's essentially a painless treatment and immediate result.
Okay, is this a craze? Are more and more people asking for it?
Absolutely.
They are?
You know, I mean, people, you know, a lot of people talk with their hands, and, you know,
Yeah.
they don't realize
Gives it away.
sometimes, they say too much.
What are you saying? You're looking at me right now. What do you mean?
That's what the good doctor is getting
These
it.
are beautiful hands.
No,
Look
no,
at
no, I
these.
could use it. I could,
Beautiful
you're
No, you don't need it.
diplomat. No, I could use it. I could use a lot of things, but who's got the time?
All right. We want to thank you guys for coming.
very
Thank
much.
you for
I
coming
wanna watch
see
him
us.
do it.
No, don't.
Go,
okay.
do it.
Coming up tomorrow, Jimmy Fallon
Love
is
him.
here, plus all the guys with kids.
And the
I can't
Real
even look.
Housewife,
Don't
is
look.
it Nene?
Nene.
Nene Leakes.
Nene Leakes.
Have a great
La, la,
Monday,
la,
Monday,
la, la, la.
everybody.
Take
Oh
care.
my
Don't even look. Does it
gosh.
hurt?
No.
A little.
Very
Tiny
simple.
bit. Tiny.
Wow.
Okay. We'll see you
Bye,
tomorrow,
everybody.
And then
So you
she spreads
push
it.
it?
And we'll just spread it gently through the hand.
That is wild. That is
I'm
something.
gonna look at you beautiful.
Yeah, look at Hoda.